Hi, my name is Blandina. Today, I want to talk about how you can prevent gum disease. Yes, gum disease is preventable, and knowing how to prevent it, what tools to use, can really go a long way at preventing having gum disease, preventing losing teeth, and pain around the gums. So, what is gum disease? If you browse through my videos, I have done a video on what gum disease is. Have a look. So, if you haven't had a look yet, please watch my video on what gum disease is, and then this video will make more sense. Gum disease is mainly caused by bacteria plaque, the bacteria that lives in the mouth. Most of the bacteria is good bacteria that doesn't cause problems at all, but if it's left in the mouth for a long time, it will start to cause problems, especially if it goes under the gums, between the teeth, in areas that are really difficult to clean. So because of all of this, gum disease starts to occur, and this causes inflammation, swelling, tenderness around the gum line. What are the main signs of gum disease? So for you to be aware that there is gum disease, usually you might notice bleeding. When you're brushing, the gums might bleed a little bit around the gums. When you're flossing, cleaning between the teeth, again, you might notice bleeding. When there is excessive swelling of the gums, some people will notice bleeding when they're eating, chewing, and again, when they wake up on their pillow, there might be blood on the pillow. And these are really signs that something's not right. There's some gum disease in the mouth. So when we're talking about gum disease, we are talking about early gum disease known as gingivitis, which is reversible. And we're also talking about advanced gum disease, periodontal disease, and any other infections, inflammations that happen around the gums and that cause discomfort, pain, and the gum area. In this video, I want to talk about ways of how you can prevent having gum disease at home. Yes, gum disease is preventable. Some people are more susceptible to gum disease because of genetics, because of family lines. If someone along the family has had gum disease and it's been passed down through genetics, then you might be more predisposed of having gum disease. Again, some medical histories like diabetes might make gum disease progress further in some people, and smokers as well. There's some risk that obviously might progress gum disease and might mask the signs of gum disease in smokers. So there's a number of reasons why people might have gum disease or be more predisposed to having gum disease. But even with all these predisposing factors, you can still prevent having gum disease. It just means that you have to work harder to prevent building up this plaque that will later on start to cause problems around the gums and cause inflammation. So the best way is to make sure, obviously, you're brushing your teeth twice a day. So we're advised to brush twice a day as a minimum. And when you brush twice a day, you're best to use an electric toothbrush. Electric toothbrushes have been known to work more effectively than using a manual toothbrush. However, if you're using your manual toothbrush effectively and you're not leaving a lot of plaque in the mouth, you're managing to remove all the plaque, then that's fine. And you're happy with your manual toothbrush, you can carry on using your manual toothbrush. But if you're struggling and you've realized you're getting gum disease, bleeding gums, swelling, then an electric toothbrush would work better for you. As we are all aware, toothbrushing alone is not enough to prevent gum disease. If you're brushing effectively in the mouth, at the most, you're removing about 60% of the bacteria in your mouth, which is really good, but we still have 40% left. And the 40%, that's where most of the problems are. And this is where mostly gum disease starts. Gum disease usually starts between your teeth. So if you're not flossing on a daily basis, then you are risking having gum disease. So make sure with dental flossing, you're flossing between the teeth, all the way under the gum. Make sure the gum is submerged, make sure the floss is submerged and is under the gums and is removing all the plaque from under the gum line and between the teeth. Or maybe poor dexterity, they can't really hold the floss to clean really well in the mouth. If this happens, obviously there's other dental aids that we can use. There are interdental brushes that are really, really effective, and I always recommend interdental brushes to be used twice a day together with floss. And these interdental brushes are really ideal, especially at the back where we have wider gaps there. So interdental brushes do a really good job cleaning between your molars, your premolars, and sometimes if you have wider spaces in the front, you can use an interdental brush in there as well. Just make sure, again, you're coming back and flossing if you've got really tight contacts. So the other thing is, again, some people use water flossers. If you use a water flosser, again, they're really good at getting rid of food deposits, cleaning under bridges, crowns, but however, still use a water flosser in addition or on top of flossing and interdental cleaning, because if you rely on just the water flosser, sometimes it does leave plaque behind, as plaque is really sticky. It needs really physical contact to really remove it from the tooth surface. So toothbrushing, flossing, interdental brushes, water flossers, these are the main dental aids that are effective at removing plaque and preventing gum disease. Using a mouthwash on its own is not really effective at removing the plaque on the tooth surface, because plaque, as we discussed, plaque is quite sticky. If you use a mouthwash, it's really just going to wash over the plaque surface layer. It's not really going to be able to remove the plaque, or again, it's not really going to be able to reach the bacteria that's hidden within the plaque colony. So it's not an effective way of removing plaque on its own. It needs to be used as an adjunct on top of your flossing, interdental brushes, your toothbrushing. Then you can use your floss, but make sure you're using then you can use your mouthwash. Make sure you're using your mouthwash at a different time to toothbrushing, because you don't want to straight away brush your teeth, then wash it away with a mouthwash, because we are getting rid of the goodness of your toothpaste. The fluoride that's in the toothpaste is more than the fluoride levels in your mouthwash. So you're really washing off a higher dose of fluoride in your toothpaste with a lesser dose. So always you're advised to use your mouthwash at a different time to toothbrushing. And make sure, most importantly, that you visit your dentist, visit your hygienist, so they can actually clean, give you a really good clean, removing any hard deposits of plaque, which are called tartar or calculus, that's formed on your teeth, because your toothbrush alone will not be able to remove the hardened plaque deposit called tartar or calculus. Once the plaque solidifies, it's really difficult. You need to see a professional. Now, to prevent gum disease, at least as a preventative measure, you need to have your teeth. It's recommended that you get your teeth cleaned at least every 6 months. And this is a preventative measure to prevent getting gum disease. Because at home, we're not physically able to remove each and every piece of plaque in the mouth. It's just really, there's other areas that we can't really reach. And if we're struggling, you might not be aware you're missing a certain area. But once you go and visit your hygienist, they'll be able to spot these areas and give you a good clean and prevent problems from occurring way in advance. Now, if you've already been diagnosed with gum disease, then you'll need to visit your dentist or your hygienist to give you deep cleans every 3 months or 4 monthly, dependent on how you're doing, how your gums are responding. But every 3 months, you need to get a deep clean so they can remove all the deposits, hardened deposits under the gum line, which you or myself at home, we wouldn't be able to do. But once you go and visit your hygienist, then we're able to clean for you under the gum line. After a few sessions of deep cleans, and once the gums have improved and you're cleaning really well at home with your floss, electric toothbrushes, interdental brushes, and the gums have stabilized, then your recall might be moved a bit further, depending on how you're doing. If you're not responding well, gums are not improving as they should do, then you might be referred to a periodontal specialist, which is a gum specialist. But this would obviously be discussed on your appointments. As you see how you're progressing, your dentist and hygienist would be able to devise a treatment plan for you. So I hope this video has been helpful. I hope you'll be able to now value the importance of flossing, cleaning between your teeth to prevent gum disease. Obviously, the #1 cause of tooth loss in adults is gum disease, not tooth decay. So we want to be able really to prevent having gum disease. So yeah, I hope this video has been helpful for you. Until next time, bye.